Welcome to the General Government Subcommittee joint. Would the secretary please take the roll?
Senator Golkachia. Senator Harris. Senator Neal. Assemblywoman Backus.
Present.
Assemblywoman Brown May. Assemblywoman Kasama. Assemblyman Miller. Assemblyman O'Neill. Chair Peters.
And I am here. Please remember to turn off the sound on your electronic devices so we're not interrupting people. We'll have public comment at the end of the committee today. Today we have one budget hearing for the Silver State Health Insurance Exchange. And we will go ahead and invite them to the Zoom. Thank you so much for being able to accommodate today's meeting. Remember to state your name for the record when you speak. You may begin when you're ready.
Good morning. For the record, my name is Ryan High. I'm the Executive Director of the Silver State Health Insurance Exchange, also known as Nevada Health Link. Thank you for allowing myself, our Chief Operations Officer, Janelle Davis, and Chief Financial Officer, Jonathan Lopez, to present to you today our biennial budget. I'd like to start off by talking about our vision, mission, strategic priorities, and a little bit about the history of the exchange before getting into our biennial budget detailed request. The Silver State Health Insurance Exchange is a state-based exchange and operates the online marketplace, NevadaHealthLink.com. We connect Nevadans who are not insured by their employer, Medicaid, or Medicare to health insurance needs in the state. Individuals can purchase Affordable Care Act certified, qualified health plans through the exchange. And if eligible, consumers can receive subsidies.
We are having a really hard time understanding you in the room here, and your staff has offered to present in lieu of, if that's okay, just so that we can understand the presentation. But thank you. Thank you again, and we hope you feel better soon. Please go ahead. Thank you.
Good morning, Madam Chair and members of the committee. My name is Janelle Davis. I am the Chief Operations Officer for the Silver State Health Insurance Exchange, also known as Nevada Health Link, as our Executive Director, Ryan High, said. I'm glad you were able to join via Zoom, but happy to present so that the committee can hear what we have to say during our presentation. I think he was on the slide of the Silver State Health Insurance Exchange, kind of introducing who we are and what we do. So we are a state agency that operates the online health insurance marketplace known as Nevada Health Link. We connect eligible Nevada residents who are currently not insured through their employer. They're not yet on Medicaid benefits and not yet on Medicare. Individuals can purchase Affordable Care Act certified qualified health plans or qualified dental plans through the exchange. And if eligible, they can receive subsidy assistance to help offset monthly premium costs. NevadaHealthLink.com is the only place where Nevadans can get access to financial assistance. We are also solely self-funded, no state and limited federal funds to support our operations. All right, so a little bit of our vision, mission, and values. Our vision is to provide access to health insurance for all Nevadans. Our mission is to increase the number of insured Nevadans by facilitating the purchase and sale of health insurance that provides quality health care through the creation of a transparent, simplified marketplace of qualified health plans. Our values are consumer-focused. We are innovative. The exchange strives to be innovative and forward-thinking organization. Diverse stakeholder involvement is vital to a successful implementation of the exchange. We are business friendly. The exchange is committed to creating a business friendly environment for the simple purchase of health insurance. Some of our strategic priorities. As an exchange, we have a goal to obviously reduce the number of uninsured Nevadans throughout the state. Our goal is to increase the number of insured persons in Nevada. We facilitate the purchase and sale of qualified health plans, provide consumer education and outreach on matters relating to enrollment in an effective use of health insurance, assist residents of Nevada with access to programs, premium assistance to those tax credits, and cost-sharing reductions. All right. So this slide just shows a little bit of our year-over-year enrollment since the inception of the exchange. We began operations in 2013. We were actually on the federal platform known as healthcare.gov. So that's in the beginning, 2014, 15, 16, 17, 18. And then we transitioned to our own state-based exchange. And so you can see the growth over the years. So Nevada's uninsured rate is around 11%. I would say pre-Affordable Care Act and pre-Nevada HealthLink, Nevada's uninsured rate was around 25%. We experienced our highest open enrollment plan year in 2022 with over 100,000 enrollees. This was a 24% increase from the previous enrollment year. And 88% of those enrollees are accessing subsidies to help offset their monthly premiums. Almost half of those enrollees for that plan year were paying $100 or less for their monthly plan. And this last year, plan year 2023, the Nevada Exchange experienced its second highest open enrollment with 96,379 enrollees. 86% of those who shopped received some type of financial assistance, and 40% of consumers received plans with monthly premiums of $100 or less. For healthcare to be accessible, it must be affordable, and consumers shopping on NevadaHealthLink.com found that to be true. Our next slide just shows a little bit more in depth of our open enrollment demographics. So again, the final plan selection number was 96,379. The exchange had around 18,000 new consumers enroll in health insurance. The re-enrollees was around 78,262. And this last bullet point we're very proud of, consumers paying $0 a month, was over 11,000. All right, I'm going to talk a little bit about special enrollment periods. Special enrollment periods are outside of the normal open enrollment period timeframe. The normal open enrollment period timeframe is November 1st to January 15th. A special enrollment is offered in our off-season, if you will. Excuse me. And basically, if a Nevadan experiences a qualifying life event such as having a baby, getting married, losing their Medicaid perhaps, or employer-sponsored coverage, they would be eligible to enroll anytime throughout the year as long as they report that qualifying life event change within 60 days. So I've included here all of the special enrollment periods that we have participated in or implemented over the course since our beginning. But being a state-based exchange allows for flexibilities to establish our own special enrollment periods so that more Nevadans can get covered. I'd like to focus on the last bullet point for an upcoming planned special enrollment period. This still needs to be approved by our executive board. We do have a meeting that's upcoming on March 28th, and they will approve the upcoming Medicaid unwinding of the public health emergency. But that special enrollment period will be March 31st through July 31st. Sorry, March 31st of this year to July 31st of 2024. Okay, I am going to pass it off to Jonathan Lopez. He is our Chief Financial Officer for the exchange.
Good morning, members of the committee. My name is Jonathan Lopez. For the record, I am the Chief Financial Officer for the Silver State Insurance Exchange, and I'll be going over the governor recommended funding changes. So a few highlights for fiscal year 24, we are requesting around $23,342,000, which is a 0.3% increase from base year. In fiscal year 2025, we are requesting $23,783,000, which is an increase of 2.25% from base year. We have a total number of positions of 27, 26 existing, and 1 new. Our revenue is solely based on carrier premium fees. We have no general fund in this budget. So I'll talk about our enhancements. Our first enhancements, 352, we're requesting around $19,350 for both fiscal years. These are funds to perform an annual financial audit with an independent and qualified auditing entity. These funds will be added to a current contract with our programmatic audit vendor, Barry Dunn. An annual financial audit is required for all state-based exchanges. Our next enhancement, 355, we are requesting $90,000 in fiscal year 2024. This represents cost for a security assessment known as MARCI, which stands for Minimum Acceptable Risk Standards for Exchanges. And this is required by CMS and happens every other year. Our next enhancement, 354, we are requesting $148,000, around $148,000 in fiscal year 24 and around $178,000 in fiscal year 25. This request increases funding for navigators and brokers at fiscal year 2022 base funding levels to continue awards to navigators, in-person assisters known as IPAs, and brokers. Navigators and IPAs consist of private and public entities that communicate, educate, and enroll eligible individuals in ACA certified qualified health plans. This request stabilizes funding for navigator entity partners and provides a more consistent and stable statewide pool of IPAs. And it also allows the program to expand by awarding 2 additional brokers in each year of the biennium. This can open up the request for application to rural locations as we anticipate more uninsured Nevadans accessing coverage through Nevada HealthLink. And consumers will take advantage of in-person assistance to make a well-informed decision and ultimately purchase a plan that best meets their health needs. For this slide, I'll let Janelle talk about it.
Janelle Davis for the record. Thanks, Jonathan. This slide is just went off. Sorry about that. We are requesting in decision unit E356 for state fiscal year 24 and 25. These costs represent requesting a new position for the exchange and a benefits manager effective 7/1/23. The major purpose of this position is to be an enrollment eligibility subject matter expert, a liaison of information, policy, training, certification, grant opportunities, and customer service to the exchange's certified broker community, which consists of over 700 brokers statewide. These brokers and sisters are the ones who offer free assistance to all Nevadans seeking enrollment assistance during the application process. Lastly, this position will perform outreach on behalf of the exchange to the broker community at broker events and broker community meetings. This position develops and maintains relationships with a large group of stakeholders, agents, brokers, state and federal agencies. This position will be located in our Henderson office location. This position also has parallel duties, but is separate and for a distinct population. They continually answer broker questions, again, for a community of 700 plus brokers. We also have a request for funds and a request for application for a certified broker award program. This position will manage that RFA and be a subject matter expert related to the Affordable Care Act and related provisions in the Code of Federal Regulations. Additionally, the new benefit manager will need to be versed and provide technical assistance regarding professional insurance licensing and the broker code of conduct, which Nevada HealthLink has developed. These parallel duties, but for a completely separate population of our enrollment assisters, respectfully warrants a new benefit manager position.
Jonathan Lopez for the record. I'll be going over our equipment and licenses enhancements. Enhancement 710, we are requesting $5,340 in fiscal year '24, and $21,259 in fiscal year '25. And these request funds replace computer hardware per the EAT's recommended replacement schedule. Enhancement 353, we are requesting around $1,900 in each fiscal year. These are funds for Acrobat Pro licenses to increase efficiency with our staff. The next slide talks about the travel enhancements, 350 and 351. These are both enhancements for in-state and out-of-state travel. We are requesting $41,211 in both fiscal years. During most of fiscal year 2022, the exchange was unable to use all the budgeted funds in our travel categories due to the restrictions implemented during the public health emergency. As the exchange staff has grown, these funds must be maintained to conduct necessary agency business to ensure staff are well trained to assist and benefit Nevada consumers. The exchange plans to conduct in-person meetings, site visits, and conferences during both fiscal years, as it had been doing prior to the PHE. Thus, the travel budget will need to be increased to cover all costs associated with this travel. And our last slide, we talk about our reserves. Based on current projections, the exchange expects to maintain a 180-day reserve level through fiscal year 2025. Lowering carrier premium fees is an option to reduce these levels in fiscal year 2025. And an important note, revenue from carrier premium fees is to be used for exchange purposes only. And that concludes our presentation.
Thank you for the presentation. We have several questions today. I'm going to go ahead and start with Assemblyman Miller.
Thank you, Chair. Thank you all for the presentation this morning, for taking over from a man here. We want you to get well if you're not well, but thank you for being here. My questions are related to the brokers, and the support navigators, and really where it lies is can you just, I guess, give us some detail on any stipulations for how the brokers may utilize the funding, and if there's a consideration of how many people they'll support?
Absolutely great question. Thank you for that. Janelle Davis, for the record, Chief Operations Officer for the Silver State Health Insurance Exchange. The brokers, as I said before, there's about 700 plus brokers throughout the whole community. This last plan year, consumers are allowed to designate a specific broker when they search for this free assistance, and same goes for navigators. They can designate a navigator. The broker community is much larger than the navigator community, and this last plan year, over 44,000 Nevadans out of our 96,000 community designated a broker, and in comparison for navigators, that was around 4,000.
Thank you.
Thank you for the question. Assemblywoman Brown May.
Thank you, Chair. Again, thank you for that presentation. I'm going to follow up on my colleagues' questions and really see if we can drill down a little bit more about how many more Nevadans do we think we can serve by expanding the broker guarantee program, right? You talked a little bit about we have 11% of our population are uninsured currently. You have open enrollment as we're going to unwind the medical emergency period of time. By expanding brokers, do we feel like we're going to really be able to reach more Nevadans? And any idea what the projection is?
Sure, Janelle Davis for the record, and I'll answer that to the best of my abilities, and I'll also pass it off to Ryan High, our Executive Director, if he has any further thoughts. As far as our goal is always to reduce the uninsured population throughout the state, and without brokers and our partners and our navigators, it would be impossible. They are our boots on the ground. They are the ones interacting with consumers, and we provide that education and facilitate that sale. So we do anticipate growth in our enrollment every year. That's definitely our goal, and we have experienced a lot more interest in the broker grantee program. Like I said, we grew from about almost 600 brokers in the previous year to over 700 just this last plan year. So we have an annual training certification process. And then we also have this separate certified broker award program. Part of that award program, we provide a grant, if you will, to those brokers who apply so that they can advertise essentially and educate of what Nevada HealthLink is, and especially during this unwinding period, those potentially 200,000 Medicaid recipients will be losing their coverage, and we don't want any Nevadan to experience a gap in coverage. So yes, to answer your question shortly, yes, we do anticipate growth. But I don't know, Ryan, if you want to expand on what the goals look like.
Sure, and for the record, Ryan High, Executive Director of Nevada HealthLink. Our brokers are such a trusted partner with the exchange. We promote them all the time, and they are really experts for our consumers. They provide free assistance for Nevadans. We promote them in ways such as on our website. If you click on our front page, support, find local assistance, you can just type in your address, your zip code, and be connected to brokers across the state. And these brokers really walk consumers through the eligibility and enrollment process. Let them know how they can really take advantage of the subsidies offered by the federal government, and how to protect their family and themselves from medical expenditures, and really protect them from medical debt in terms of getting healthcare coverage.
Thank you, Mr. High. We had some construction noise going on in the room. It was a little startling there. It was that Assemblywoman Kasama. Please go ahead.
Thank you, Chair. Thank you for the presentation. A little following up with my colleague too, just for me to understand, if we got the message out to everybody, and if we advertised enough and through all the different venues, would every Nevadan have health insurance through this plan? Because we have Medicare, Medicaid, and then we have the HealthLink here now. Would it capture everybody if everybody knew about it, or who would be those left that you couldn't insure?
That's a really good question. I'll take that. Janelle Davis for the record. So as you mentioned, we have people who are on Medicaid, and that's around a 930,000 universe. We have the health insurance exchange, which we're at about 97,000. And then we have Medicare, obviously. Our mission and vision is to capture everybody on the exchange, or capture every Nevadan. We don't want anybody to go uninsured or to experience a gap in coverage depending on what type of insurance they lose. However, in order to qualify for the health insurance exchange, you do have to be a citizen of the United States. You do have to be a Nevada resident, and you have to show proof of that documentation, as also to receive financial assistance to help pay for your monthly premium. So a population that kind of goes missing is the undocumented population.
Thank you. May I follow up with one other thing? So we passed last session the public health option, the public option. How does that fit in with this? Or does it? Or how would it? So if we advertised enough, we would capture everybody in the state of Nevada, that is a Nevada resident and a U.S. citizen. We would capture everybody. So how would that fit in, or how would that help?
I'm going to pass this one off to Ryan High, our Executive Director.
Hello, thank you for the question. I appreciate it. So one other group that are not covered on the exchange. So the exchange covers those consumers that do not have Medicaid, Medicare, nor employer-sponsored insurance. The public option would be an option, would be one more selection that would be sold on the exchange So right now we offer plans that are different metal tiers: bronze, silver, gold. The public option would be one more option for consumers to shop on the exchange. It would offer the 10 essential health benefits. It would be an ACA, Affordable Care Act compliant plan. It would be one more option, but it would be at a rate less than typical exchange plans right now. So it would be almost like an option between Medicaid and the exchange plans.
Could I follow up, Chair? So, so it would be a level or a different plan that just had more subsidies on it? Is that what I was hearing? I had a little trouble hearing. Would that be the short answer?
Apologies for that. I'm in my office, by the way, too, just by myself. So it would be a plan that would offer the almost like an exchange plan, but at a lower price point. It would be between the first year 5% less, up to almost 15 or 16% less after 4 years. But it would offer all of the same benefits, though, that the Affordable Care Act does require, those 10 essential health benefits, to consumers shopping on the marketplace here at Nevada Healthline. So it would be one more option, I would say. One more option. It wouldn't be a bronze plan. It wouldn't be a silver plan or a gold plan. It would be one more option for consumers to purchase and help lower that uninsured rate here in Nevada.
Thank you.
Sorry, Janelle Davis for the record. I just wanted to follow up that we can provide some helpful information from the public option public listening sessions that we had with the Division of Healthcare Finance and Policy. They go into much more detail about how the public option would work, and it would not be implemented until 2026. Mm-hmm.
Thank you for that follow-up. We'll ask that the whole committee get that information, please. I had a couple of questions. Sorry. I'm going to ask them because it's kind of related to the plan, and then I have another couple questions from committee members. We didn't talk about dental and vision separate from the plans that you did discuss, kind of how many folks are on the exchange. And then I didn't hear Mr. High about any platinum plans, which I've gotten several constituent questions about the potential for platinum plans on the state exchange. So kind of two questions. What's happening on the exchange for dental and vision? Where are we at with those and the utilization of those? And then is there a plan at all or the potential for platinum plans being offered on the exchange?
Thank you. For the record, Ryan High, Executive Director of Nevada Healthline. We do offer standalone dental plans on the exchange, so consumers can go on to nevadahealthline.com and shop for either qualified health plans or standalone dental plans. We also do offer a link to a VSP vision product on our exchange, so consumers can also go to nevadahealthline.com, click on that link for VSP and find a standalone vision plan if they want. Regarding platinum plans, we do not offer currently platinum plans on the exchange. It is a possibility, but consumers are really finding that the three metal tiers that we do offer, the bronze, silver, and gold, provide enormous choices for consumers. We have over 163 different plan options throughout the state of Nevada. And let's say, for instance, the rating area 1, which is Clark County and Nye County, consumers have a choice of over 100 different plans they can shop for alone in just that one rating area. So, consumers have a lot of choices already with the bronze, silver, and gold plans. And that silver plan really is a great value for consumers. Consumers that do choose that and qualify do receive subsidies. Also, they may get cost sharing reductions. So when they actually go to their provider, those costs will be reduced for them if they do get those cost sharing reductions.
Janelle Davis, for the record, I just wanted to add a little bit more to that. Thank you, Ryan. I'm not sure, Assemblywoman Peters, if you're asking for the percentage or the amount of people enrolled in a dental plan and a vision plan. We don't have that at the top of our head, but we can certainly get that to you if that's what you're looking for. And as far as platinum plans, I just wanted to mention that previously when the exchange was on healthcare.gov, and even when we first transitioned to a state-based exchange, we did offer platinum plans, but we no longer do. And the exchange does not require insurance carriers who sell on exchange plans to offer them. But we certainly can revisit that if it's something the committee is interested in.
I think I'd be interested in the justification for not offering them. Was it utilization? Was it and lack of interest, or was it premiums that were unattainable? What was the reason we dropped the platinum plans? That would be helpful. And then yes, the percentage of general numbers of utilization of the standalone vision and dental plans. I think that would be helpful too. And just to clarify, those dental and vision plans, they don't qualify for the federal subsidies, right? Those are just plans that the state exchange has negotiated to include on the exchange, but they're relatively affordable. Could you talk a little bit about like the makeup of those?
That's correct. And Ryan, please chime in if I'm missing the mark here. Janelle Davis for the record. But yes, you are correct. As far as dental plans and vision plans, they're extremely affordable. I think the average dental plan is around like $23 a month. And you no longer have to be enrolled in a qualified health plan in order to sign up for a dental plan or vision plan, for example. Before, when we were on healthcare.gov, you had to be enrolled in a QHP before you could access a dental plan. And we didn't have vision plans back then either.
And Ryan, hi for the record. Dental plans those consumers do receive subsidies, but there are also QHPs that do have an add-on, let's say, both dental services and vision services. If consumers want to shop for that type of QHP or qualified health plan with those add-ons, but also part of the 10 essential health benefits for children do include dental as well.
Thank you for that. I have another question from Senator Harris.
Thank you, Chair Peters. Could you just discuss the efforts to encourage brokers in rural areas to apply for the broker grantee program?
Sure. Janelle Davis for the record. Thank you for your question. There has been an ongoing interest for just the rural population in general to receive more resources and information. It is definitely a trickier population to get to, but you know, they matter just as much, obviously. And so that's part of our reasoning for adding more brokers to the broker award program. So that we can get someone actually physically out there to provide enrollment assistance to the rural populations. It has grown over the years since we started the program. For example, we have, instead of just a few in Clark County, we now have one in Pahrump, for example. We also have navigators who essentially do the same thing, but this broker program provides funds for marketing and education.
So, just a quick follow-up, if you don't mind. So I heard at the end there that the program provides dollars for marketing and education, but could you talk about what you're doing maybe with those dollars to do the marketing to try and get these folks in?
Sure. Janelle Davis for the record. And so the request for application that the brokers apply for is essentially an award program, and so the exchange funds the brokers who win that award. So it's actually up to the brokers who apply to decide what they want to do, but there are requirements, obviously, and that includes making a billboard or a radio advertisement, and they have to get that approved by Nevada HealthLink primarily. They also get to put, a preferred broker status on their signature. And these are brokers who have a very, very large book of business, and we're hoping to see that grow. So that's what I mean by marketing and advertising.
Got it. I understand. Thank you. So can you then take it a step back for me? Then I guess I'm more interested in what are you all doing to get people to apply?
I mean, a whirlwind of things. Janelle Davis, for the record. We do have a communications team. We are partnered with a marketing vendor, the Abbey Agency. And since the inception of the exchange, we've been partnered with different marketing vendors. We have a $3.2 million marketing budget over the course of a year. So that's not just open enrollment. It used to just be, okay, let's talk to people during open enrollment. Now it's throughout the whole year because so many people are eligible for special enrollment periods. So this is a full-fledged traditional media campaign. This is outreach that we do with our brokers, our navigators, our executive director, our communications team. We're constantly in the media, in the news. We visit our congressional delegation. We have email marketing lists. I mean, the list goes on. I hope that you see us everywhere because that's where we're intended to be.
Yeah, I didn't mean the program as a whole. I meant just kind of specifically targeted. Is there any targeted marketing to encourage brokers in rural areas to apply for the broker grantee program? So out of that $3.2 million, is there a effort at all to outreach specifically to brokers in the rural areas to get them to then apply for that program?
I understand now. Janelle Davis, for the record. So April 1st, when the request for application goes out for that program, we actually just send out publications in like newspapers and on our website. So I wouldn't say that there's a specific, rural population that we reach out to, but we reach out to all. I mean, we blanket the entire state to get everybody to apply.
All right, we made it. Thank you.
Thank you for the question. Assemblywoman Backus.
Thank you so much, Madam Chair. And mine kind of deals along the same lines, but I'm going to focus on enhancement E356, which was on one of your guys' slides that you went, actually, Ms. Davis, you went into detail on. And I kind of think this segues from, because I know we were talking about the recruitment of brokers on one end that Senator Harris had asked you about, but with respect to the request for the new benefit manager position, I understand that there will be like a liaison to the brokers. Can you kind of elaborate a little more on that as to how this new position would support exchange brokers and ultimately consumers purchasing insurance on the exchange? And I see that you have that slotted to be filled by July 2023, which feels like around the corner, and wondering if that would be possible to fill that position by that time period.
Thank you for your question, Janelle Davis, for the record. I'll start with the latter half of your question. I know most positions usually begin in October, but the need for this new position to begin in July, as opposed to that time frame, is the need to update the annual training that Nevada HealthLink pushes out to our broker community. There's a whole training and certification materials with the latest information from the Center for Medicare and Medicaid Services in preparation for our September release. Also, these broker services are going to be needed to assist with the unwinding of the public health emergency that is slated to begin April 1. And so to answer your other question, yes, we do have total, I'm lacking the word here, we're very positive that we will be able to fill that position by the July timeframe, as well as applying or getting someone to assist that person now that the administrative assistant position would then be open. And so basically the current benefit manager role specifically services navigators and navigating entities. And as I stated in the beginning of our presentation, the navigator world is much smaller. They are mainly located in Clark County, and there are about, I would say, 27 maybe actual individuals who are partnered as navigators. And that includes nonprofit organizations, and the total number of entities that we grant funds to is around 7 or 8, I believe. And so again, this position would be assisting and servicing the broker community, which is over 700. So the calls that this broker manager position gets is, I mean, completely inundated. This is one of our most important stakeholder groups, and as I said, the training is coming up, and so we definitely need to be prepared prior to that September timeframe.
Madam Chair, may I have a follow-up? My follow-up kind of overlaps something you had said earlier with the $3.2 million marketing that you do. I was curious of that because it sounds like there's two avenues. One, the exchange is doing their own marketing directly out to consumers, and then there's also the grants available to brokers. Are the grants available to brokers within that $3.2 million, or is there a separate amount of money?
Janelle Davis, for the record, it is a separate part of the budget.
And if I may, just out of curiosity, how much do you guys put into that grant program?
Yeah, Jonathan Lopez for the record. Currently, we are putting $60,000 into the broker program, and I think around 1.5 million into the navigator program.
Thank you. Are there other questions? Yep, Assemblyman Miller.
Yeah, thank you, Chair. I just have a quick question with the, you mentioned the importance of the stakeholder group, that the 700 brokers that the broker manager position will handle. Are you confident that is there another broker manager position, or are you confident that the one will be able to handle the workload?
Janelle Davis for the record. So right now there is a benefits manager position currently, and they oversee the navigator program. So we're requesting this benefit manager position to oversee the broker program, and we are confident that the one position will be able to handle the load.
Thank you.
Assemblywoman Kasama.
Thank you, Chair, for the indulgence. I just have a big picture money question. So the majority of your revenues come in from the 3.05% carrier premium piece. Is that correct? Is that all the revenue source for Nevada Health Link?
Yes, that's all. Oh, Jonathan Lopez for the record.
That's the complete source for the revenues. And then when we have the subsidies that are given to people that apply online, those subsidies that are provided, is that coming out of this fee revenue, or is that from federal funds that are flowing through?
It's from federal funds.
Thank you so
Yeah,
much.
Jonathan.
Other questions? All right. I think we're done. Thank you so much for the presentation and information. We will close the hearing on this budget and move on to our final item for the day, public comment. We're going to do public comment here in Carson City and Las Vegas, and then go to the phones. We'll let you guys get it. Yeah, thank you so much. All right, if there's anyone in Carson City who'd like to provide public comment today. Seeing none. Anyone in Las Vegas for public comment? Seeing no one in the room. BPS, would you check the phone lines for public comment today?
Chair, the line is open and working, but there are no callers at this time.
Thank you so much. With that being the end of our agenda today, we are adjourned.